Sir, may we know your name?
My name is Otive Igbuzor, the Executive Director of the African Center for Leadership, Strategy and Development, Center LSD.
Okay. So what is the essence and what prompted this meeting or workshop you held?
The workshop is actually a training of staff to commence our project on Community-Led Total Sanitation, on waste management advocacy. We have observed that many people die from diseases related to improper sanitation and poor waste management. And it is appalling that all over the world, 500,000 children die every day from diarrhea-related diseases. And in Nigeria, about 5 million children die every year. And that translates to about 13,700 children dying every day from diseases related to improper sanitation, to improper waste disposal. And so our center observed that within the Federal Capital Territory, there are many slums, there are many poor communities that have very poor sanitation and waste management procedures, that have open defecation sites that people defecate openly. In fact, we implemented this project last year in Durumi community. By the time we started the project, there were only about 6 toilets. By the time we concluded, there were about 60 toilets in the community. It's a community-led total sanitation is a participatory approach that involves igniting the community to take the issues of sanitation and waste management very seriously. And so the community members will participate in the process, have an action plan, to make sure that they have proper ventilated toilets, so they have proper waste disposal. And when we did it in Durumi, it was a very big success. But this time around, we are implementing it in Kwizi community of Kuje local government. Kuje area council.
Okay, so I heard your reason, but how do you intend to go about this after the workshop? So what's going to be?
Yeah, the workshop is actually the beginning point to train the staff. After that, we started the community entry process, where we will discuss with the gatekeepers, the chief within the community, and they will mobilize the entire community to know the dangers of orophycal transmission of diseases. Like what we normally do, it will become obvious to the community that the diseases that are prevalent in the community, such as diarrhea, dysentery, typhoid fever, can be traced to the improper sanitation of the community. It's a process. By the time we roll out the process, the community will be ignited, and then they will have their action plan by themselves on what they will do to improve sanitation, hygiene, and proper waste management in the community.
Okay, sir, please, who are the kind of staff you're going to be working with?
Usually we have staff in the center, about 5 staff. In fact, the training is ongoing, it's still continuing right now. It's a 2-day training. We have a project officer, we have project associates, and we have an intern, and they are all being trained. We have 5 staff that are going. And these people, we work with the community people, and they will also work with government agencies like FCT Sanitation Unit, embarked Sanitation Unit. In fact, the Federal Minister of Water Resources, Mrs. Sarah Chegbe, was represented at the ceremony, or the training ceremony. And so we'll work with government agencies, because essentially after the AEPB is responsible for waste disposal, we will also advocate to them to do proper waste disposal, just as we did in Durumi community.
Okay, so the last time we did in Durumi, this time around, do you intend to cover the whole area councils in FCT?
Well, as resources, we are supported by CIDA, Canadian International Development Agency, CIDA. As we get more resources, we'll cover more communities. But our advocacy is that government at all levels, federal government, the FCT government, the area council government, should adopt this simple approach of igniting the community. We are prepared to build the capacity of the relevant agencies for them to, because as NGO we are limited in what we can do, but our approach has shown that government can adopt this approach and will be able to bring about a more, because sanitation is one of the goals that we are not likely to meet. One of the MGG goals, the one on the environment, we are not likely to meet unless we do things differently. And this one clear way that we can do things differently.
Okay, so now if you look at some communities, like in the outskirts of Abuja, if you go to Gwagwalada or some places, when we're talking about sanitation now, if you look, they have only a place where they get drinking water, cooking water, and you see them having bilharzia. So those kind of communities that don't really have water, good water to drink, potable water to drink. So what would this advocacy all about to them?
There are different dimensions. The first is that when there is water, the possibility of greater sanitation increases. But we also know that behavior is very important. Orientation of the people. There are places, for instance, in what we did in Durumi, without improvement in the water condition, sanitation condition improved because there was change in behavior. But if you want it to be sustainable, then every sector must perform their duties. Government must provide water, while the people must change their behavior. And when all of this work together, you have a better sanitation for the community.
So I don't know if there's any other question at all. There's something very important to think you can add.
Well, what I just want to add is that it is important for government to do everything possible to achieve the MDGs. With the present rate, it is unlikely that we'll achieve most of the goals in the MDGs. But we must see development as a holistic approach. So the transformation agenda that has just been released, there is need for a social transformation agenda that will reorient people. There is need for a political transformation agenda. It's not just economic transformation that will change this country. I think that is one major thing that is lacking today. Transformation agenda without the political transformation, without social transformation, reorientation, cannot deliver the results.
Okay. I just remembered last year you had this thing, and I know you had your assessment on ground. So what do you think, and now you're having, is it what you got from the outcome of what you had?
Yes, we were very, in fact, if you have time, you can go to Durumi and see. You get it. The way Durumi was last year before we intervened has changed completely. When we intervened, all the in connection in partnership with AEPB, all the dump sites were cleared. We provided waste bags, and now in Durumi they collect their waste in waste bags. Before we intervened, there were about only 6 toilets. At the time we left, the people themselves have mobilized themselves and built about 60 toilets. The Kuizi community that we're intervening now, we have done the profile analysis. There's only 1 toilet in the community. At the end of the project, we'll be able to tell you through our intervention, how many toilets that the people can build. We are not building the toilet for them. They build it themselves. The only thing we do is to empower them with the information that they require. And I think that government can learn from this. Government does not need to do everything for people, but government can empower people with the necessary information, inspire people with the necessary leadership so that they will be able to do things for themselves. I think that is the greatest lesson from this our approach.
Thank you very much.